All right, so starting off with the first question, can you tell us a little bit about yourself and your journey to becoming a physician?
Yeah, so I was interested in medicine from a very young age. I had a really fantastic, very charismatic pediatrician, and I think like many of us, just so much of everyone's kind of professional journey is kind of who you meet, and but he was fantastic, and I didn't have anyone in my family in medicine or STEM or anything like that. I just um, always found science really interesting. And between that and having this pediatrician and just seeing how much, I thought he was great and how much all the other patients kind of loved him, I was really drawn to that. And actually, from when I was like, I don't know, 5 or something, I would like ask him like, "Can I work with you?" And I don't know what that says about me, but and he would say, "Okay, maybe when you're like 14 or something, you can like volunteer." And I'd be like, "Okay." And so every year I would meet him and I'd say, "Okay, can I work with you?" And sure enough, I turned 14 and I was allowed to, volunteer a bit, yeah, mostly doing like filing and things like that. But I just loved like being in that environment and seeing everything. I think I just always knew. I think it was just, it was just the perfect kind of combination of being connected to science and, you know, getting to work with people, which is really what I love. And, you know, um, it was just kind of a natural thing. There wasn't really any other interest. I don't know what else I would do, honestly. And I feel very lucky to have kind of known from a young age. In terms of how I kind of came to neurology specifically.
My
Um,
next question, so take it away.
uh, I would say, I always found the brain in particular fascinating. I'm a little biased, but I don't know, how can you not? I think we're essentially brains in jars, and um, I think there were a couple things. I remember, like, I think if you ask many neurologists, they might say a similar thing. I've read some books by this famous neurologist, Oliver Sacks, who wrote these stories about his patients and, just the kind of really interesting thing you can see. And there was definitely a very honest and very kind of humanist bend to everything. And, I was also kind of interested in, you know, ethics, kind of philosophy. So when I went to undergrad, I majored in neuroscience, and I, you know, uh, I also studied, philosophy and was interested in consciousness and ethics. So I kind of was in that world. And by the time I got to medical school, I went in with an inkling that that might be, but I honestly, in my major clinical year, I drove my now wife crazy because, deciding because I honestly, I really liked everything. I mean, I think part of my personality. I think I would have been happy at the end of the day doing whatever. But I loved every rotation. I was like, oh, OB is great. I could see myself doing this. Whatever. And um, I think I really ultimately decided kind of last minute. I did a couple different sub-Is and medicine. I did one, and I was also thinking about pediatrics. Once I kind of decided I liked the OR, but I didn't, absolutely love it. So that kind of helped. And then, the more I thought about it, I think I was just very interested in everything. But what kind of helped is thinking that, if I didn't do neurology, I think I would miss that the most. And for whatever the reason that when I really thought about that, um, I think, I just had to do this. I think I would really miss being kind of connected to that field. The other thing is that I was also pretty interested in infectious disease and in rheumatology. So I was really kind of deciding between like doing rheum and neuro or maybe ID. and I learned about this kind of burgeoning field of neuroimmunology, which is kind of the combination of everything. So once I kind of had that, and of course I had some really great mentors in that school that really kind of solidified it for me. And I think the big things also that I knew I was looking for is, I really just love, people and getting to know folks and helping them kind of navigate various transitions in life and that kind of long-term relationship. And, how's little Timmy doing? I mean, that's the kind of like medicine that I really like. I think partly inspired by having that like great pediatrician who I knew for a long time. And I think that, so I knew I wanted something with that kind of continuity. And that's a big part of neuroimmunology, although, I think there's also certainly a role for inpatient neuroimmunologists. But, I think a lot of our patients we start seeing at a younger age because a lot of autoimmune diseases kind of happen, in more early adulthood. And, we have a really unique opportunity to help people navigate all these kind of stages in their life, help them navigate all kinds of transitions, pregnancy and menopause and all these various kind of goals that they have. And I think it's a really kind of special thing.
That's amazing. Thank you so much for sharing. Um, were you, I guess you were deciding between a few other specialties,
Yeah.
um, and you ultimately decided neurology. I guess my other question was just going to be like how ultimately, like during your neurology residency, you then, or I guess you kind of gave me the reasoning for why you want to do neuroimmunology, but kind of like how you found your way through that path and what that the transition from residency to fellowship looked like as someone in neuroimmunology.
Yeah, sure. So, again, I kind of like went into residency pretty sure that I wanted to do neuro. Once I kind of learned that that was a thing, because I didn't know. And honestly, I think many physicians, even within neurology, don't even know that this is a specialty. It's a really new world, and a very small world. And so I started shadowing once I kind of heard about it. I started for my course director. I started shadowing with the MS physician who's actually more of a pediatric MS doc. Um, and seeing that, I think that was very helpful, that experience, and being able to do that as a med student. I think, definitely shadow whenever you can. Um, and so I kind of went into residency with the inkling. And then I very quickly, once I started, really after maternity here, I reached out to the neuroimmunologists at my institution and, started working with them when I could. Um, and I think that I both found it fascinating, but again, it was seeing that kind of long-term relationship, which you certainly have in many other aspects of neurology and other fields. But seeing how I mean, I think for many folks, for a lot of the time, but not always, multiple sclerosis or whatever one of these conditions are, might be their really main or only health problem. And so you kind of become like their doctor. And I really like that aspect of it and seeing that happen. So I think that really clinched it. And then for fellowship, I stayed at the same place. I really like the people there. And, in I would say in neuroimmunology, there are folks who really specialize pretty much almost exclusively as MS doctors, as multiple sclerosis doctors. And then there are some who kind of focus on kind of the kind of other things, so kind of systemic autoimmune disease that affect the central nervous system, so like lupus and Sjogren's and Behçet's and autoimmune encephalitis and some of these other things. And I felt that the program I went to had a really nice balance between everything, and also some kind of a low ID too. And it was also really I knew folks there and they were really good to me, and so I was very happy to stay. Um, I'll say neuroimmunology fellowship is definitely much uh, definitely a quality of life improvement over residency. Um, I think, and I would say it, my fellowship was pretty indicative of what my future as a attending. I'm a new attending, I'll say, in a fellowship. But I think it's pretty indicative. So it's pretty standard kind of office hours for the most part. So 8 essentially to 5:36. Um, Monday to Friday. Can't really do that too much in terms of medicine. Um, you know, as an attending, we do some call, but it's really not basic. Certainly residency was rather busy as it is for everyone. And I mean, I think it was very, taxing, but I'm very grateful for it, especially now. I mean, I think, um, you know, uh, that's what you want. You want to be busy. You want to see as many people as you can and get as much out of it as you can. Because especially now as a new attending, I'm very grateful for having as much kind of exposure to different things as I was able to. And I think same during fellowship, you just want to soak up as much as possible. I think what's also really important in neurology is having a good foundation in medicine. The first year of residency is, pretty much exclusively internal medicine with some neurology electives in there. And I think it's really important to get as much out of that as you can because I mean, there's so much crossover. And I think especially, for neuroimmunology, where there's a lot of kind of room and idea and a lot of kind of systemic um, conditions that we see or um, are in our differential. Also, oncology, I think, is a big part of what we see. Um, yeah,
Um, I know you kind of touched on them a little bit, but I did want to ask, just for the listeners here, like what, and I know you mentioned multiple sclerosis, but I guess kind of in addition to that, and you can touch on that as well, like what are the main kind of conditions or diseases that you see in clinic and that you treat?
yeah, absolutely. So I'd say multiple sclerosis is by far the most common of these conditions. Many of these are very uncommon. So I would say that makes up for most neuroimmunology. I mean, uh, you know, I would say going off more of my fellowship data since I'm new here, it's probably on the order of 70%, give or take. It's a vast majority of what we see. So I think it's definitely good to make sure you're interested in MS. Um, I would say making up the remainder would be, um, you know, systemic autoimmune conditions. So again, things like lupus, other demyelinating disorders, of course. That's another kind of sizable part, I would say. So that would be things like myelitis optica, um, low some of these other kind of antibody-mediated diseases. Sjogren's, Behçet's, and then I would say, um, you know, um, autoimmune encephalitis is certainly part of it. And, you know, we'll often get involved in,
Sorry, my connection just cut out for a second.
yeah, no problem. So yeah, autoimmune encephalitis is definitely part of it. We tend to be involved in some of the inpatient cases and then get to see them as an outpatient, which is, I think, very cool to do, see people that know you're quite sick and get to, manage them later on when they're doing better. And yeah, that's certainly another part. We of course get a lot of consults for, you know, um, is this MS or there's some kind of white matter lesion in the brain. Does it seem like some inflammatory thing or not? Um, So, there's certainly a lot of really that kind of stuff too.
That is very interesting. Thank you so much.
Mhm.
Um, you touched on this a little bit. The fellowship work-life balance seems pretty nice, but we just had some questions about, generally like how is your work-life balance and kind of what a typical week or day in the life looks like.
Yeah, absolutely, and very important question. Uh, I think especially I think I realized how important this stuff was. I think you don't think about that stuff, or well, I didn't think about that stuff yeah, as a med student. Um, and I think my first year, my internship was as a medical intern, actually in the ICU during COVID in March 2020.
Oh,
And,
wow.
going through all that, I think really showed how you really need, it's very important to have the work-life balance, and very healthy to do so. And I feel very lucky that in certain, I would say many of neurology, but definitely in neuroimmunology, it's very easy to do. So it's really outpatient based for the most part, um, specialty, and uh, it's really Monday to Friday. Like I said, it's a 5:36, give or take. So really not bad. Um, maybe 8 to 5. It depends, but really cannot complain. I have a now just a 4-year-old, and I'm able to pick her up and drop her off most days at her preschool, which is really important to me. And um, I see my family and friends and be very involved in everything. And it's been great. I feel that I really able to have a good balance there.
It's amazing. I know that will be very interesting to our listeners because having a good work-life balance is very important. We cannot find that in every field. So thank you for sharing
Yeah,
that.
yeah. I mean, I will say, I think there really are ways that you can make whatever you do what you want, but it's certainly and that fit your lifestyle, because I think we forget, but we do have expertise, and we do have real skills, and people are willing to work with you. Um, but yeah, it's definitely, I think, pretty easy to do, and pretty standard, and
Um, I guess in terms of, kind of you have the work-life balance, but within the work balance realm, um, I wanted to ask a question about research.
Mhm.
So I know a lot of people in academic medicine do a little bit of research, either earlier in the careers or now. So I just wanted to see if there's a research project that you're working on now, or even that you worked on early in your career that you think is especially interesting or exciting. And I guess kind of like what do you hope it could eventually change for patients down the line?
Yeah, yeah, no, great question. So I think one of the things that's really exciting about neuroimmunology is just how much we uh, have learned and still need to learn. And I mean, the field has changed so much with various monoclonal antibodies, immunotherapies. There's just so much out there. I think, learning a new antibody-mediated disease every couple of weeks, it seems. So it's a lot to stay on top of, but it's exciting. And we have so many things to offer. There are more than 20 FDA-approved medications for multiple sclerosis. And if you just went even a decade ago, I mean, those numbers would be rather different. And I really didn't do very much research as a med student. I worked on one project for a long time, didn't really go anywhere. It was a good experience. I learned a lot from it, but um, you know, and similarly in residency, I didn't do as much in terms of research. I was always really interested in medical education, so I was very involved with that. I did some stuff on the curriculum committee and as a med student, and then I kind of continued some of that as a resident, and did a lot of like teaching stuff, and same as a fellow. It was really during though my fellowship I got involved in research. So really before then, I didn't. do that much. But you know, I trained at a place that was pretty involved in doing clinical trials, and became very interested in that. And so I think that's one of the things I'm excited and hopefully can bring soon is some clinical trials for some of these conditions. I became particularly interested in cellular therapies. So this is a very new field. We're talking phase one studies, but CAR T therapy, which has really changed the game for oncology. And uh, People are now looking into it for use in autoimmune diseases. So it's being looked at in the rheumatology world for things like lupus, systemic sclerosis, but there are some trials now trying to use it for MS. So who knows? It's extremely early. The first kind of phase one are happening now, but I'm hoping to kind of get involved in that world. I would say also I forgot to mention neuroimmunology. Um, Often gets involved in kind of neurotoxicity from these oncologic therapies. So, people with CAR T can have this neurotoxicity called ICANS, and we're often involved in the treatment of those, kind of inflammatory adverse events. Same thing with like checkpoint inhibitors. That's another aspect of what we do. But hoping to kind of get involved with that world. I think we're looking to, you know, uh, start a kind of prospective registry for our neuroimmunology patients here. Um, I think there's a lot that we're just beginning. Working very closely with my partner here, Stephanie Gambleman, who's phenomenal and really kind of was the pioneer here for neuroimmunology, and we're really excited about building, one of the first big kind of MS centers in Westchester. So we're kind of working on all of that right now.
That's incredible. It sounds like it's a very exciting time to be in neuroimmunology. Um, do you find that it's easy or hard to kind of like incorporate research into your, I guess, daily schedule? Um, I know things have changed for you recently because you went from fellowship to being an attending. But I guess given your kind of current attending schedule, how easy or hard do you like foresee it being to get involved with these projects and have time for that?
Yeah, I think it's definitely, definitely possible. I think, uh, yeah, it's doable. I would say most folks in general will have some component of so-called admin time. So that's a good opportunity to do meetings, do some research, and then just kind of incorporating it also when you can in your other clinic time and things. But it's I think doable. I mean, I think eventually if you it kind of depends how big a part of your practice, but if you want to get involved, usually that involves needing some kind of grant support or, if you're doing kind of a trial with industry, that can be used to help kind of change around your clinic schedule and have you devote a little bit more portion to research time. So I think as, if you want to, and you can kind of increasingly make it a part of your role. But I think it's very easy to do, and I think everyone at WC is very open to that. So
All right, perfect. Um, the next question is kind of, I guess, somewhat similar, but do you think, or I guess kind of how do you think the field will change over the next few years and then maybe over the next 20 years?
yeah, I think it's increasingly inside. Again, I mean, I think we're still learning about whole diseases. So, being able to even have that is, I think, really helpful and something very important, to have a better kind of even label or something for patients. But along with that, I think we increasingly understand the biology of those conditions more. You know, I think the monoclonals were a huge advance for us, and then these really excellent kind of infusion kind of meds, which are really highly effective in kind of in preventing relapse. I think one thing that we're all very interested in MS is, I think our meds are really good at suppressing these big inflammatory attacks, but I think there's a lot of room for improvement in the kind of subtle progression that patients can experience. And I think we are hopeful that maybe some of these newer technologies, things like cell therapy, um, and maybe some treatments that instead of having someone on more of a lifelong therapy, maybe doing some kind of upfront, powerful kind of induction therapy to kind of change the immune system. I think we're hopeful for, because I think these drugs are great. People do worry about what does it mean to be on one of these cell therapies for 20 years. I think there certainly could be some side effects with that. So I think we're excited about all these kind of new technologies and strategies that are, and I think there's also a lot of hope in maybe some more kind of neuro rehab treatments and kind of remyelination. And, there's a lot of stuff out there that is actively being looked into.
That's very cool. Um, the next question is, what do you think is the biggest kind of challenge facing neurologists today?
Yeah, I would say that probably, and I don't think we're unique in this, but I think a big challenge is the insurance landscape and these prior authorizations. I think certainly in neuroimmunology, a lot of our medicines are rather complicated and expensive, and uh, insurance companies don't always align with what we think might be the best for a patient. So I would say, not insignificant part of our time and sorry, I think we kind of off our stuff, but I would say a not insignificant part of our time is spent kind of fighting back with insurance companies and having to kind of advocate for our patients and to get them what we think is the appropriate medicine. I think it's particularly complex because many of our conditions, like I said, were only recently discovered. A lot of these conditions, we know a decent amount about, but there's not an official FDA approved medicine for them. So there's no FDA approved medicine for autoimmune encephalitis, right? Like there's no FDA approved medicine for MOGAD, and because of that, I think insurance companies can really push back. But we have to advocate for patients. I'm happy to do it, but it is a challenging part of what we do, and it takes up more time than I would like. If I had to pick one thing that don't like about the field, it would probably be that.
Yeah, I can imagine that's very frustrating to know what medication you want to give your patient and have struggles getting that approved.
Yes.
Um, I guess on the other hand, do you have any advice for aspiring neurologists?
Yeah, I mean, I think again, just see and do as much as you can. And, I think what's great about neurology is how much the exam really matters. I think, we have, great things. We have MRI, we have EEG, all these other tests, but, at the end of the day, I think first the exam really matters. And I think the only way, to get good at it is, you gotta see patients and you gotta examine people and see what's normal and what's not. And um, just see as many folks as you can, so that you can kind of hone those skills. Because sometimes all it takes is a subtle finding, and that's what you need to figure out what might be going on. So I think that those kind of technical exam skills really matter.
Great. And then the last question is, this is kind of just a fun one, but what is your favorite part of the brain or central nervous system and why?
Ooh, interesting. Well, I'm definitely more of a central nervous system person. I would say again, yeah, just as a side, as an neuroimmunologist, we really focus on the central nervous system, whereas peripheral kind of autoimmune things tends to be more under the wheelhouse of neuromuscular. If I had to pick a specific area, maybe I think maybe I would pick the fusiform face area. So that's in the inferior temporal lobe, and I think I think it's just very interesting how there's a part of our brain that's um, particularly attuned to recognizing faces. I think it says a lot about um, humanity and how we evolved and how we're really social creatures and how important that is to us that we would kind of devote this space. I mean, it does other things too. Nothing was that straightforward, but I think it is very interesting. Yeah.
Well, hopefully that inspires some of us first year med students who will be continuing neuroanatomy this coming semester.